Motherhood. It's a magical journey, a roller coaster of emotions, excitement, and new beginnings. From the moment a woman conceives to the day she welcomes her bundle of joy, it's a journey filled with dreams, hopes, and of course, a bit of nervous anticipation. But this journey is not always smooth sailing. It comes with its fair share of challenges, and sometimes complications arise that can put both mother and child at risk. That's why proper medical care during pregnancy is not just important, it is a matter of life and death. In some parts of Nigeria, maternal and neonatal mortality rates are heartbreakingly high. But in Ogun State, the story is different. Since 2019, Governor Dapo Abiodun has been on a mission, embarking on an all-out war against maternal and child mortality. His goal is to drive the numbers down to zero, and he is pulling out all the stops to make it happen.
A Dr. Paul Farmer once said, and Dr. Paul Farmer is a renowned global health advocate. He says, the idea that some lives matter less is the root of all that is wrong with the world. By collaborating to enhance healthcare for all, we in Ogun State uphold this principle, ensuring that healthcare is accessible and equitable.
Governor Dapo Abiodun's strategy is not just one size fits all. He is tackling this challenge from all angles. First, by upgrading healthcare facilities to ensure mothers get the best care. Second is the expansion of the healthcare workforce by bringing in more hands to save lives before embarking on training community midwives, and then the introduction of Ibidero, a groundbreaking health insurance scheme that lifts the financial burden off expecting mothers across Ogun State. Since assuming office, the Ogun State government under Governor Dapo Abiodun's administration has employed over 400 community healthcare workers across all the 20 local government areas of the state, trained midwives to ensure safer deliveries, rehabilitated numerous primary healthcare centers, and equipped these centers with ambulances for emergency responses. And then there is Ibidero, which is the real game changer. This exclusive health insurance scheme, designed specifically for expecting mothers, ensures that every woman, no matter her financial status, gets free prenatal and postnatal care. What this means is that in Ogun State, there is no more worrying about medical bills, just safe deliveries and healthy babies.
I'm sure you've noticed recently, the Ibidero is a pregnant women's insurance scheme where the governor chose to give free delivery to our women, be it cesarean, be it normal delivery. And you would have noticed that in the last, I think it was November, that the coordinating minister for health actually announced that across Nigeria, that cesarean section will be free for all women in public facilities. That shows that Ogun State, had been, proactive in making sure that our women are safe.
Governor Abiodun is not done yet. His commitment to zero maternal mortality just got another big boost. Recently, his deputy, Noimot Salako Oyedele, represented him at the launch of a federal government-backed initiative, the Maternal Mortality Reduction Innovation and Initiatives, Mamii. It is an initiative of the federal government in partnership with the state government and the coordinating Minister of Health and Social Welfare, Professor Ali Pate, joins the Deputy Governor, the State Commissioner for Health, and other key stakeholders to champion this life-saving cause. As always, Ogun State is the first in the country to launch Mamii, M-A-M-I-I, a proof that this program is not just another policy on paper, but action-packed and designed to create data-driven, practical solutions to tackle maternal and neonatal mortality head-on. Some of the key targets include a field study to develop specific action plan that is unique to each state, then the upgrading of 774 healthcare centers across the nation and transforming them into referral centers.
So you are here as part of this effort to go deeper, to focus on the subset of the 172 local governments which account for more than half maternal mortality in our country, some of which are here in Ogun State, to go deeper, to have multiple agencies that are involved. On the supply side, at the national level, the primary healthcare agency. At the state level, you have your primary healthcare efforts as well. The health insurance, at least from the federal government side, it works with the state health insurance authorities as well. And other entities, the sector-wide coordination office, which brings some resources from HOPE, which is the $1 billion facility that was recently approved for all the 36 states to incentivize them to achieve results.
The Deputy Governor Noimot Salako Oyedele highlights the state's ongoing efforts to ensure no mother loses her life giving birth. She says the launch of Mamii in Ogun State speaks to the urgency and priority the state and federal government place on protecting mothers and their newborns.
As we embark on the implementation of the Mamii initiative in Ogun State, I urge all stakeholders, the state healthcare team under the leadership of the Commissioner for Health, Dr. Tomi Koka, our healthcare professionals in the private and public sector, development partners, community leaders, and all who are interested in the healthcare of women, to fully engage in the co-creation process. Let us leverage innovation, collaboration, and data-driven strategies to drastically reduce and crush maternal and newborn mortality in Ogun State.
The State Commissioner for Health, Dr. Tomi Koka, shares her insights on the significance of this initiative and how it will complement Ogun's existing maternal health programs.
This co-creation workshop is a unique opportunity for us to engage, strategize, and align our efforts with evidence-based solutions that would significantly reduce maternal and newborn death. Through this initiative, we aim to strengthen our health sector infrastructure, improve service delivery, and ensure equitable access to life-saving interventions for our mothers and their newborns.
With Mamii, Governor Dapo Abiodun is proving once again that when it comes to healthcare, he means business. His approach is strategic, innovative, and data-driven, focusing on solutions that actually work, not just copy and paste policies from elsewhere. He is on a mission to ensure that every expectant mother in Ogun State receives top-notch care before, during, and after childbirth.